There is a shortage of a medication used to treat men with an advanced stage of prostate cancer right now. The drug called Pluvicto is just in short supply. Its maker, Novartis, in fact, says that it cannot allow further supply to new patients until it can produce more of the drug. So for perspective, prostate cancer is the second leading cause of death in men, behind lung cancer. Local urologist Dr. Ali Kasraeian is joining us this morning. Good morning. Thanks for being here.
Thank you for having me.
I know that when we spoke, you said you actually have patients who've been impacted by this. I mean, what are they telling you? It must be very worrisome.
So with this, one thing to kind of think about and put this in perspective. So Pluvicto is a medication, a very elegant medication used for patients who have advanced prostate cancer outside their prostate. They have been on the standard of care therapies that we typically use to block the hormone testosterone, and sometimes next generation blockade of testosterone at the level of the prostate cancer cells, and one chemotherapy. So these are patients who are a bit more advanced in their prostate cancer, and so their prostate cancer is now metastatic, meaning outside their prostate. They're resistant to the hormone blockade, and so now this is the next line to that. So this isn't someone that's just been diagnosed with prostate cancer and they're deciding between surgery and radiation whether to monitor the prostate cancer, to put it into the perspective of what we're looking at. So then, this medicine is really an elegant medicine where it binds and targets the PSMA, which is a prostate-specific membrane antigen, which got a lot of attention a few years ago when it got approved last March.
A lot of excitement about it,
Very
because some have
exciting.
said they've seen a dramatic increase. I mean, looking at maybe months more to, in living or even longer.
Big studies showed a 15-month survival advantage in these patients versus 11 months with standard of care. And what's cool about it is that we had a PSMA PET scan, which is a very specific targeted imaging study. So you use an imaging study to find a lesion that is taken up by the same target imaging ligand, is called this, and then you can potentially use the same kind of treatment targeted to that area. And how this works is basically imagine that you have a targeted delivery of a focus of a small delivery of radiation therapy to the prostate cancer cell. So that's how this works. So the problem with this is you have a patient that's now needing something beyond those second, third line therapies, and now they don't have access to it, and it puts you in a difficult place. Fortunately for the company, people who have started therapy, they try to get them to therapy, and so it's a difficult situation. And basically it comes to the fact that the supply is farther than the demand. And the company is working very hard to submit to FDA for production in the U.S. side. Right now they're producing in Italy, which has the issues, and they're trying to build and open up another site. So again,
are there any options? I mean, what are you telling your patients? Because they could be halfway through, for example. I know that Novartis has said that we're trying to use what we have to give to those patients who are currently taking the medication, but new patients may not be able to get this. What other options are there?
So what I would urge you as a patient who's dealing with advanced prostate cancer, and this is a very important thing to think about, is talk to your urologist, make sure you have a medical oncologist in your therapy. So that's a very important thing for anyone dealing with a prostate cancer that's outside their prostate or recurrent, that you have a team approach to this. Medical oncologist, urologist is a gatekeeper of this, and then also if needed, a radiation oncologist, because there are a lot of different therapies that you can think about and it's personalized. You can look at genomics, you could look at the biology of the cancer, and kind of really from a specific aspect look at different types of hormone blockades, different radiation-based therapies that you can do depending on what the imaging.
Is there anything else coming out, like a trial, anything that might be able to help these patients?
So here in town at Cancer Specialists in North Florida, they're actually doing a Pluvicto trial versus standard of care for patients to see if this can actually be used as a first-line therapy, and the medication will probably be available for that. So again, talking to your urologist, seeing if you can talk to a medical oncologist to see if you're a candidate is very important. And again, talking to your doctors, seeing if there are options from that standpoint is very, very important, because there are ways to personalize treatment in this situation, which unfortunately is very, very difficult right now. We're looking at probably about 4 to 6 months before realistically that new places can open up to produce it in the United States. The FDA is trying to expedite everything from that standpoint.
But I feel like we have been seeing these shortage in drugs, which is very concerning. Dr. Kasraeian, thank you for being here. And I want to give our viewers just some background, and you mentioned this. So Novartis, its plant in Italy is what's struggling to keep up with demand, and it's also its manufacturing facility in New Jersey had to suspend production That could be remedied, though, in the next few months.